I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. And today we are bringing you a virtual version of our Advocacy for Thriving Communities Roadshow. We love coming to various communities, visiting communities around the state throughout the year, but we know that it doesn't always work out to go to the roadshow location near you. And so we wanted to have a virtual option for folks at the end of the year who weren't able to catch us when we were in your area, and also something that people can refer back to as a recording. So we've condensed this a little bit today. I'll share the agenda in just a minute, but Brittany, why don't we go to the next slide? All right. If you're not familiar with Thrive Kentucky, our group, our coalition advocates for public policies that support Kentuckians in meeting their basic needs. And we have a number of guiding principles that help us identify what kinds of policies really do advance Kentuckians and make sure that we're leveling the playing field for folks. And you can read those here on this slide. I'm not going to go through them, but you'll get a copy of these slides and the recording, and you'll be able to take a look at those if you haven't already. We can go to the next slide. Here are the members of our Thrive Kentucky campaign. So you can see the organizations that are working together on meeting those basic needs through that policy advocacy work. And if you're interested in learning more about any of our organizations, you can click on these links. We can go to the next slide. We appreciate the support of our sponsors for helping us to bring these Thrive Kentucky roadshows and the webinars to all of our networks at no cost, and by providing free CEUs for certified community health workers and social workers. If your organization is interested in sponsoring Thrive in 2026, please let us know. Kelly Talby would be the person to reach out to, and we'll make sure that her email address is in the chat. We can go to the next slide. All right, just a little bit of housekeeping. You may have noticed that you can't see each other's screens. You can see the presenters, members of Thrive Kentucky. You won't be able to see each other throughout this webinar. Unfortunately, we've been Zoom bombed a few times, and we have put in some additional security measures. We do want people to be able to interact though in the chat. So please be sure to ask any questions, to make any comments, let us know what's happening in your community in the chat, and we'll try to get to those as we go along. We'll also be sharing lots of information and links in the chat. So keep an eye on that. And we have a digital folder that I hope you got a link to already. If not, we can actually put that in the chat as well, if you didn't get it through registration. And that will bring you to lots of the documents that we're going to be going through today. We use a lot of acronyms when we're talking, and so we've put together a glossary, also electronic, that you can refer to if you hear something that's not familiar to you. And as I mentioned earlier, we're going to be sending out the slide deck along with that electronic resource folder, any other materials that we share today, the recording, and a link to the evaluation in a follow-up email. And we love to get people's feedback to hear, what was important and useful information for you, what maybe wasn't as helpful, what you want more of in upcoming future calls. So please let us know if you are looking for CEUs. You need to do the evaluation, but we really welcome everyone to send us their feedback. And with that, we go to the next slide. This is the agenda that we're going to be covering today. It's a condensed version of the 3-hour roadshow agenda that we have when we're in person. So we'll be starting with civic engagement, the advocacy section, and then going into some of our topical updates. And I'm going to hand it over to Dr. Sheila Schuster to get us started.
Thank you very much, Emily, and good morning to you all. We're so glad to have you. It's more fun when we can see you in person in your community, but we really appreciate your being with us. I'm a psychologist with the Advocacy Action Network, and have been doing advocacy for a long, long time. Actually went to Frankfurt in 1978 And I've been going ever since, trying to figure out how to get things done up there. So I want to share with you some of the things that I learned so you could avoid some of the big mistakes that I made and probably still make some of them. But advocacy is just so critical. Next slide, please, Brittany. So let's remind ourselves that democracy requires the voice of the people to be heard. This particular picture is one of the coalitions that I run out of the Advocacy Action Network. It's the 874K Disabilities Coalition, representing more than 874,000 Kentuckians. That's 23% of our population who have a disability of one kind or another. So if you think about that group, and this is why I love working with them, they could represent the biggest voting bloc in the Commonwealth or actually across the country. They often have been disenfranchised, told that their voices don't matter. And so we've worked hard with people in the disability community. And these are disabilities across all disabilities. So mobility, sensory, developmental, intellectual, acquired brain injuries, mental illness, substance use disorders. And it's very empowering for people to find that they do have a voice. So just to remind you that we can't keep our democracy unless all of us people are willing to be heard. Next, please. So just a reminder that the legislators and actually the people in the governor are all elected by us, whether you voted for them or not, but they are elected to serve you. And again, we must use our voice to let people know who are policymakers what we need. We can't hold them accountable unless they have heard from us and they understand what our issues are. Next, please, Brittany. So I'm going to make the case that that voice should be yours. You are more knowledgeable about your community and your issues than anybody who is serving in some role in Frankfort. So you know your community and you know your issues much better than the 138 legislators or all the people that are in the cabinets and all the departments. So you're knowledgeable about them. You want to provide accurate and important information. I've been doing advocacy training for 20 plus years, I guess, to all kinds of audiences. And when I ask people, have you talked to your legislator? A lot of people are kind of sheepish and they say, no, I really haven't. And if they're honest with me, when I say to them, how come you haven't? Many of them will say, well, I'm afraid they're going to ask me a question and I'm not going to know the answer to it, which is certainly an uncomfortable situation for all of us. So let's say you're in Frankfort, you're meeting with your senator, Senator Brown, and you're having an excellent conversation about your issue. And he says to you, well, Sheila, what's the impact of this on the state budget? That's called a demand situation because he has power and I don't. And so I think, oh my gosh, he must think I have the answer. And so your tendency, if you're good at kind of coming up with something on the fly, is to pull an answer out of your left ear and give him an answer. I beg you not to do that because what you want to do is to have a second opportunity to get back with Senator Brown and to be a trusted source of information. So the thing to do is to say, Senator Brown, that is a great question. I don't have that information with me, but I will get it for you. What's the best way for me to get it back to you? And in all likelihood, he will give you, sometimes they'll give you their cell phone number. Sometimes they'll say, use a different email address. He may say, there's somebody in this office and here's their email address, or I have a college student intern and they're gathering this information. But try not to leave that meeting without having some way to get back with that answer. And then do your homework. Come up with the best information that you can and get it back to Senator Brown. That's the way that you establish a relationship as a source of information. We have access to free media, meaning that we don't pay for media. We don't have people that organize that, but we have the stories, and that's the important part of this advocacy. We can rally grassroots support, which means the ordinary citizens back home. We work in coalitions, and we'll talk about how important coalitions are. But we need to be willing to speak up and to do it often. And then the other thing is we need to be committed to keep on keeping on. I call that the Energizer Bunny syndrome, but that's a really important part of advocacy. Brittany? So here's my guilt slide. If you want to protect yourself, you can. This is one of our rallies in the convention center in Frankfurt before it was torn down. And we used to have these every other year. And we would have 600, 700, 800 people with disabilities and their legislators sitting at tables. So my question to you is, who understands the issues better than you do? There are very few people that understand your lived experience or your community's experiences and what you've learned through that. Whose voice will be heard? And my big question is, if you don't speak out, who will speak? So you could look to your left and your right and say, are you willing to go to Frankfurt? Are you willing to contact them, send an email, and so forth? But you need to take some responsibility. We all need to take some responsibility for getting that message across to policymakers. And remember, they can't serve you unless they hear from you. Next, please, Brittany. So let's look at the context that we're going to be doing advocacy. We are mid-December right now. In something like 3 weeks, the 2026 General Assembly session will open, and they open on Tuesday, January 6th. They always open on the first Tuesday after the first Monday in January, and they will then adjourn. They have to adjourn by April 15th or on April 15th at midnight, according to the Constitution. So it's what we call a 60-day session. Now, if you count the days from January 6th to April 15th, it's more than 60 days. They have periods where they are not in session, for instance, over the veto period and so forth, but they will have 60 legislative days. So the most important thing that they have to do during this session is to create and pass the biennium budget. And we always say that the budget is the values document or the priorities document for the Commonwealth, and that's the spending over the next 2 years. Our job as advocates is to make sure that people are at the top of that list of priorities, whether it's access to health care through Medicaid, whether it's access to food through SNAP, whether it's access to affordable housing. All of these are topics that you're going to hear about today. But we know that Kentuckians are in need of the basics, those things that are what we call the social determinants of health, or the things that make communities thrive, and we want to make those priorities. All the current House and Senate members will serve during this session. So if your legislators were elected a year ago, they're still going to be there this session. We will have a new senator from South Louisville. That election is tomorrow, and it fills the remainder of Senator David Yates' term, who resigned to become the county clerk here in Jefferson County. House and Senate leadership members remain as currently elected. I want to warn you that it's going to be a tough session in terms of public access to legislators. If you've been in Frankfurt recently, you know how much of it is under construction. They are completely redoing the Capitol building, so it's closed. The governor's office, the AG's office, all of those have moved out of the Capitol building, and it's closed. The sessions will be held in a temporary building that's been constructed actually in the corner of the parking lot, and there's a kind of weird above ground outdoor tunnel that they've created for legislators to walk through to get to that meeting space. There will be no public viewing in the legislative session. All of that will have to be done via KET. There will be rooms set up, we're told, in the annex, where if you're in Frankfurt, you can stay there and watch it, but it's not the same as talking with legislators as you walk over with them or meeting them when they recess. It's going to be much, much more difficult. Big rallies in the rotunda will be non-existent. There's a small education building that can be reserved. The really big rallies would have to be held outdoors, which in this weather is going to be challenging. So it's not impossible, but we're all going to have to work a bit harder. Next, Brittany. Just want to remind you that the interim task forces, and they're listed here, wrapped up. All of them have wrapped up except the MAHA, or Make America Healthy Again, Kentucky Task Force. They will meet tomorrow with their recommendations, but we're giving you the links to the final reports and recommendations from all of those task forces. I think Adrienne will talk particularly about the housing task force when she speaks with you. Next, please. So the Rural Health Transformation Fund was created as part of HR 1, or the One Big Beautiful Bill Act. And I think every state has submitted an application. Kentucky has submitted an application to get additional funding for the next 5 years. We will know on December 31st whether we were awarded any of that money, but there is some summary information. They're going to concentrate in the rural areas around maternal and child health, around behavioral health, around dental health, and around chronic diseases such as obesity and diabetes. They also will be or have proposed that they will shore up crisis services in rural areas. Next, please, Brittany. So we've talked on previous webinars about the Medicaid Oversight and Advisory Board meetings. This is a 25-member board, the majority of whom are legislators. There are 10 citizen members, the Commissioner of Medicaid, the Secretary of the Cabinet, the Auditor, the Budget Director, and so forth. I'm one of those 10 by virtue of being the chair of the Medicaid Advisory Council. The members who are not legislators do not have a vote, but we do have a voice. So at our meeting last week, we had a preliminary set of findings and recommendations, and you can see the link to those. The various topics included, and I've listed them here: administrative problems, budget growth, insufficiency, transparency. They did recommend expanding an integrated behavioral health system of care and developing an alternate dental delivery model across Kentucky. They will be revised at our meeting on January 12th for a final time and then submitted. So those are things that you may want to take a look at and then try to attend in person or remotely that January 12th meeting. Next, please. So I'm not going to go into a lot of detail about that HR 1. I know that Priscilla is going to go into that, but essentially it creates massive problems for us to keep people on Medicaid or on a qualified health plan. It also is making access to SNAP much more difficulty. There was a report published that 35 rural hospitals in Kentucky are at risk of closing. We had testimony from the Hospital Association at the Moab meeting, and they said they didn't think 35 hospitals would actually close, but they might close some services. And they named specifically maternal health, particularly delivery, behavioral health, which is mental illness and substance use disorders, and ER. And those are critical services for all of us to get. Next, please. So just a reminder, this is what I call my therapy slide. If you were coming in regularly to see me in therapy and you kept talking about the same problem, the same problem, the same problem, and weren't really doing anything about it, I would probably say to you at some point, you've got to decide whether you're going to just sit and be a victim of this or whether you're going to do something about it. And I make the analogy with Frankfurt, not that everything they do is bad, but they're going to do their thing. They're going to go up there and look over probably 1,500 different bills, and they are going to pass some of them. They're going to revise and pass some of them. They're going to defeat some of them. They're going to pass a budget. So that action is going to happen whether we're there or not. And my plea, my urge is that you be active in that system, that you raise your voice so that you're not sitting back just as a victim, but that you're really trying to influence what happens in Frankfurt. Next, please, Brittany. All kinds of ways to engage the community. One is to build coalitions. The more you spread the word about what your community's needs are and so forth, and particularly including unlikely allies. And I'll use an example. We've been working for years on expungement of the records of felony offenders for drug possession, which used to be a felony, and it keeps people from getting jobs. And we've been working on that in the legislature for a couple of years. And here comes a really powerful ally, the Chamber of Commerce. The Kentucky Chamber of Commerce wields a lot of influence and power in Frankfurt. And we're like, what's their interest in this? Well, their interest in this is the lack of able-bodied workforce in Kentucky. And a lot of these felon offenders are young males mostly who have gotten involved with drugs and now are in recovery and are wanting to get into the workforce. So that's an example of a kind of unlikely ally that can help. Use your social media. A lot of the legislators, you can follow what they're talking and thinking about um, with their tweets and their Facebook posts and so forth. Next, please. So storytelling is really the heart of advocacy. And if Holly Hudnall will put her email in the chat, Holly is our wonderful storyteller. She helps people get their stories into a shape so that it can be, a small video can be made of it. The other thing you can do, if you're going to go up and meet with Senator Brown and you know a constituent, a friend of yours who has a critical story to tell and they can't go to Frankfurt with you, take your phone, go over and talk with Mrs. Jones and tell her to send a message to Senator Brown. Take that with you. And when you meet with Senator Brown, you can say, I know you know Ida Jones lives on 24th Street, and she couldn't come today, but here's her message to you. And he will remember that message, and it fits in with our advocacy. Next, please. So lots of ways of lifting up the voices. We call that putting a face on the problem. So you can have all the data, you can have all the rationale, but the stories are what people remember. So if you could take your problem and have a person tell that story, we passed a huge piece of legislation in 2000 to force the insurance companies to treat mental health and substance use disorders the same way they treated physical health and to quit discriminating. And we passed it really because we had people step forward to tell their story, and that's what people remember. So it's that combination of having your facts and figures, but really having that story to tell. Next, please. So I want to remind you that our issues are not political or partisan. There's nothing political or partisan about people being healthy or having a roof over their head or having enough food that they're not hungry, that they have some place to take their child care and so forth. The process is political. So you know that both the House and the Senate are controlled by Republicans. That does not mean that your Democratic representative or senator does not have power. They have a voice and they work very well across the aisle. You're important as a constituent with your legislator because you have the power to vote them stay in office or to leave office. And remember to tell your story, put a face on the problem. Next, please. So a couple of powerful statements to say to a legislator, I'm your constituent and I vote. You can send an email with that as a subject line. Send it to your senator and to your representative, not to all 138. If you're working with representatives and senators in your area, you may be working with their constituents at your job. And you can also say, I'm not your constituent, but I work with your constituents in my role as whatever that is. Remember that our relationships are ongoing. It's not I used to say John Calipari, but he's gone from UK, but it's not a one and done. It's not coming one time with your hand out and then never being heard from again. You want to have a working relationship with the legislators. Next, please. So www.legislature.ky.gov is your go-to place for all kinds of information, including who your legislators are and lots of background about them. You can also use that to find out what committees are meeting, where a bill is in the process, and what the content of the bill is. The important phone number is 1-800-372-7181. They have wonderful switchboard operators. I always say I don't know what kind of medication they're on, but they are without doubt the most helpful and agreeable and pleasant people. And they will walk you through the process. You can call and leave a message for a legislator, for a committee, and so forth. So an important way to have your voice heard. Next, please. So all kinds of ways to stay in touch. You probably know by now that I guess a year and a half ago, they changed their email addresses. So it's first name dot last name at kylegislature.gov. You can also call our office 564-8100 and ask to speak to their secretary or their receptionist and leave a message. And again, if you're a constituent, make that the leading thing that you say. Next, please. And some helpful hints. This is more likely a marathon than a sprint. I've already talked about keeping on, keeping on. Build coalitions wherever you go. And then the Schuster rule is celebrate every good thing that happens to your bill. So when it gets introduced, you celebrate. When it gets assigned to a committee, you celebrate. When it passes a committee, so forth and so on. It could be a long slog to go through a 60-day session. So you've got to give those self reinforcements and enjoy it. Next, please. Politics are local. So those of you, particularly in rural communities, I think always feel like you're left out and don't have power. The truth is that of the Republican leadership in the House and Senate, the majority are from rural counties. Sometimes I feel like coming from Louisville is a strike against me because legislators will kind of poo-poo Louisville or Lexington. And work with your local legislators, your local metro council, your mayor, your county judge exec, because they all know those legislators. And if you have a good relationship with a local legislator, that could be very powerful. Next, please. We have a few things in their packet, the difference between advocacy and lobbying. And I'm not going to go through these, but I know some of you work for agencies that forbid lobbying. When you raise your voice as a citizen to educate a legislator about an issue, you are not lobbying. Just as simple as that. Next, please. I think there's another one about advocacy and lobbying. Yeah, this gives you some real life examples of what would be advocacy and what would be lobbying. Next, please. And I'm going to end with this, my favorite Margaret Mead quote, never doubt that a small group of thoughtful, committed citizens can change the world. And I believe that you all are that small, thoughtful, committed group. You have my email address, kyadvocacy@gmail.com. If you have any questions, please send me an email. And I am happy to turn it over to my friend, Dustin Pugel.
Wonderful. Well, good morning, everyone. My name is Dustin Pugel. I'm the Policy Director at the Kentucky Center for Economic Policy. We're a nonpartisan, nonprofit research and advocacy outfit. And we're also a proud member of Thrive. So we like to follow up Dr. Schuster's really rousing presentation on advocacy and getting things done with a really rousing overview of Kentucky's economy, budget, and tax situation. So we think it's a really helpful way of thinking through, what the context is for the needs in Kentucky that a lot of the programs we will talk about address, but also, how we pay for them and what our legislature has in the works for this upcoming session. So let's go to the next slide and just start talking a little bit about affordability. Now, I think affordability is a little bit of a buzzword right now. We've heard a lot about this, particularly in recent elections. But the truth of the matter is, cost of living has always been an issue for at least half of Kentuckians, where making ends meet is really difficult. And that's only gotten worse in the past several years as inflation has really increased the cost of some really necessary items. So while all items have increased between 2020 and this year by about 27%, some things like transportation, shelter, and energy and food actually have increased by more than that. Other things like medical care have increased slower, but still by quite a bit, 15%, which is particularly a problem when you think about the expiring tax credits that we'll talk about later. So if we go to the next slide, the other side of that coin, though, is that the median household and median wages have not kept up over time. So even as things have gotten more expensive, and this is really a demonstration of that because this is inflation adjusted wages over that time, people have not, at least at the median, which is the halfway point for all earners, they haven't been able to make the similar types of gains, which is a real concern. So if we go on to the next slide, this is a good just sort of illustration of this yellow bar is the median family income, and these blue bars are different household compositions. So, different number of adults and children by county. And you'll see that it doesn't really matter if you're in an urban county or a rural county. It's still really difficult to make ends meet on the kinds of wages that are available to us, particularly if you have kids. If you don't have kids, then it's a little bit easier, but certainly with kids, it's more expensive, and we really want to make sure that families are able to get by. If we go to the next slide, you'll see that it's not the same everywhere. So in rural parts of the state, the cost of living is a little bit lower than urban parts of the state, particularly in places like Boone and Oldham counties, Scott County, and Warren County. But all that to say that, if we're concerned about economic security, think at the end of the day, we're really concerned about making sure people can make ends meet. If you want to read more about our analysis of affordability in Kentucky, so Holly's put a link to our website in the chat. I'm going to put a link to this particular analysis where you can kind of go and see what it takes to get by in your county. Now, obviously, the best way to make ends meet is to have a job. So if we go to the next slide, I think there's still a lot of good news in our labor market. We are still hiring more than people are being laid off. We're over 100,000 jobs above our previous high point in February of 2020. And we've had a really long and solid recovery from what was a really devastating but brief recession following COVID. We've had one of the best recoveries that we've had compared to past recessions even. So while not everyone is able to find a job in all parts of the state, we are certainly moving in the right direction for now. And I'll talk a little bit more about that later. If we go to the next slide, just to take a quick look at the unemployment rate. The unemployment is defined as people who are currently looking for work but can't land a job. And we're in a decent position there too right now. The unemployment rate in Kentucky in September was 4.7%. I think that number is actually out of date. It's actually just shy of 100,000 workers now who are still out there looking for a job out of a workforce of about 2 million. So, you'll see over time this sort of initial swell in unemployment or in unemployed workers. That was during the Great Recession. There was a spike during COVID. It rose actually over the last couple of years, but it's starting to decline again. And that could mean several things, but generally speaking, that's where we want to see it head toward. If we go to the next slide, not everyone is working though, and some people are out of the labor force entirely. They're not even looking for a job necessarily. If we look at the prime age workforce, these are folks between the ages of 25 and 54. About 20% are not currently in the workforce, and that's actually a smaller share than we've seen over the past 50 years. So the folks who do want to work, which is most of us, are actually having a pretty good chance being able to find a job right now, which is great. And if you compare our current prime age workforce participation rate to the rest of the countries, we're pretty close to the same. We're within about 3 percentage points of the national average, which is a much narrower gap than what we have seen in the past. So, the folks who we would anticipate, being out of college but not quite retirement age, they're on the job by and large. If we go to the next slide, though, if we look at that 20% who are not, there's actually a survey that asks every year, why aren't you? What's keeping you from being in a regular full-time job? And the answers are probably not surprising to folks on this call, particularly those of you who work with folks with disabilities or people who are caring for their loved ones. Those are the top two reasons that people are not on the job who are in the same age category. So they're ill or disabled, or they're at home taking care of a loved one. Oftentimes, that loved one is someone who is ill or disabled, but a lot of times it's a child, right? Because we know that childcare is exceedingly expensive and a lot of folks can't afford it, or it wouldn't really make a lot of financial sense for them to take a job where, the majority or all of their income was just going to pay for that childcare. The rest of the reasons are things like going to school, they're retired, some other reason that the survey couldn't identify, or they're looking for work and they can't find a job, which is about the same as our unemployed rate. That's really, I think, helpful to know, in part because, there's not some sort of nefarious reason why most folks are out of work. But also, to the extent that people who are ill or disabled or who are taking care of a loved one want to have a job, that means that there are additional supports we could provide them that would allow them to re-enter the workforce and continue on in a career. So if we go to the next slide, I also want to point out that the opportunity for jobs is not the same across our state. So you saw the cost of living spread earlier, but there's also a reality in which people in Eastern Kentucky in particular have a much lower workforce participation rate. Now, one thing I hear in Frankfurt all the time is that this phrase, nobody wants to work anymore. And what they point to for that is that there's a low workforce participation rate across the state. Well, if you take Appalachia and you separate it from the rest of the state, you see two very different stories. The balance of the state has a workforce participation rate that's pretty much in line with the rest of the country. It's really indistinguishable. Eastern Kentucky, though, has a long history of economic hardship that stems from a lot of extractive economies that sort of built themselves up as the sole sort of tentpole industry in the economy, the sort of midpoint that holds up the rest of the tent. And when coal, for a lot of reasons, starting with mechanization in the 1950s, followed by environmental regulations and the cheapening of natural gas and the explosion of renewable energy sources, starting in the 90s through the early aughts. When all that happened, a lot of that middle tentpole got knocked out, and so all the surrounding industries that it supported, came down with it. And so a lot of folks who would love to work are having a hard time, which is also why we see a big population shift out of Eastern Kentucky as people move into more urban and sort of western parts of the state to find employment. So, what I think this message to me says is that it's not that people are lazy or that nobody wants to work anymore. It's that Eastern Kentucky in particular needs investment, it needs more industry, and it needs opportunities for people to work because they want to, and they will if they get the chance. All right, let's move on to the next slide. I painted a relatively rosy picture of our job situation, and our wages are doing okay. They're not great, but they could be doing much worse. At the same time, though, there are a lot of things that economists and others are concerned about down the line that could really upset what we have right now, which is a somewhat stable economic situation. Those things include things like across the board tariffs, reduced immigration, which then reduces our workforce, particularly in industries like construction, among our healthcare workforce, and then software developers. There are a lot of federal cuts and layoffs that result in people losing employment or reducing their wages. It also puts a lot of pressure on folks who are looking for employment in the private sector because there's a whole wave of federal employees who have left who are also looking for a job. The income tax in Kentucky, I'll talk about this later, but that puts a lot of pressure on our state budget and could create problems like around school districts and healthcare facilities. There's a large housing shortage you'll hear about later, and there's an increased pace and intensity of natural disasters that make it more difficult to maintain our current housing stock. That makes it more expensive to afford a home, but it also means that there's less economic activity generated around the homes we have. There's an increase in automation, specifically through AI. I mentioned how mechanization in the 1950s really hurt the coal industry in Kentucky back then. Well, I think we're seeing a similar transition for a lot of white collar jobs right now happening with AI, particularly at sort of like entry level positions. And then, believe it or not, the economy can be impacted by untrustworthy official government data. There's been a lot of political interference with data collection in DC, and that really could create a problem in being able to accurately forecast and analyze what's happening in the business community. There's one big storm cloud, though, on the horizon that we're already starting to deal with. If we could move on to the next slide, and that's HR1, or the One Big Beautiful Bill Act. This is folks, I've already forgotten, it's a very large tax cut package, particularly for the wealthy, that was partially offset through very large cuts to programs, particularly Medicaid and SNAP. And so, as you can see from this chart, it's sort of a distribution. If you go to the right, we're talking about sort of higher income folks. If you go to the left, we're talking about the poorest folks in America. And as you can see, the poorer you are, the bigger a loser you are from this bill. The cuts to Medicaid and SNAP far outweigh any kind of tax cut benefit that you might end up seeing due to this bill. So, this is a real concern. It's also something that we will have to start dealing with here at the state level within our state budget. So if we go to the next slide, we are days away now, believe it or not, from the next General Assembly in Kentucky. And this year is the second year of this particular General Assembly, which means it's a budget year. We are going to be determining how we as a state are going to spend our money for the next 2 years. And I want to share a few things about this. But just to start out, I think it is important for us all to have in mind that a budget's a moral document, right? It's a statement about what we value. And so our General Assembly members are going to be making a lot of value choices moving forward. I could say a lot about sort of the history of our state budget and how things have worked out. But if we go to the next slide, one big determining factor is what we're going to do about a reduction in revenue that has come from large income tax cuts. We've cut our federal income tax 3 times now, which has reduced it by something like $2.1 billion each year. Each half percentage point tax cut reduces our state income by $718 million. And those are starting to add up. If you look at this chart, the large yellow bar there represents the entirety of our state general fund. It's about $15.3 billion each year. That's all the money that we bring in through all the types of tax revenue as a state. The annual tax cuts, or the value of the annual tax cuts at both the state and the federal level, is right now about $8.8 billion. If you look at just the top 1%, it's something like $1.7 billion, which is about half of what we're spending on Medicaid. So the wealthy in our state have really seen an enormous windfall, and that's putting additional pressures on our ability to raise enough revenue to cover our bills. If we go to the next slide, this is already starting to show up. So this is the year-over-year change in revenue in Kentucky. And I want you to pay attention to the yellow bar in particular. The yellow bar is the inflation-adjusted year-over-year change. And what we'll see is that, during leading up to and during COVID, there was a big swell in revenue, which made a big difference in our ability to expand services. But that revenue was also used to justify very large income tax cuts. And so what we've seen happen instead is essentially a return to recession era level revenue trends. We are moving toward a situation where despite a decent economy, a growing economy, we could end up looking at potential budget cuts, not just sort of like holding steady and letting inflation erode our existing investments, but potential reductions in investments. There's already sort of rumblings about that in the current fiscal year that we're in, a potential shortfall at the end of the year. And so places like the Cabinet for Health and Family Services are considering cuts, but that's what we're moving toward. If we go on to the next slide, this is my final slide. At the same time, a lot of that money that we had generated during COVID ended up in our budget reserve trust fund. We actually ran surpluses for many years that we put in our state's budget reserve trust fund, much more than we need. So if you look at this dotted yellow line, that's what most economists and policymakers think is sort of the standard for what we would need to have socked away. And right now we have about 10 percentage points more than that, about 3.7, almost $3.8 billion sitting in our state savings account. So I think what I want to end on is just this idea that the money, we have the money to be able to make investments. We will continue to be able to have money so long as we don't cut our income tax. And it's going to be really important as we move into this fiscal year that if a statement really is a if a budget really is a statement about what we value, we need to consider and talk to our legislators about what we value most. So with that, I'm going to hand it over to Adrienne, who's going to kick us off on some housing updates.
Thanks, Dustin. Hi, everyone. Adrienne Bush with the Homeless and Housing Coalition of Kentucky here in Frankfort. And it's good to be with you all. We are a statewide organization working to ensure every Kentuckian has a place to call home. And with that, we can move to the next slide. All right, so just some brief level setting. It's important to remember that part of the reason housing is becoming such a challenge is that based on our federal funding, only 1 in 4 families who qualify for housing assistance actually get it through public housing, through a housing choice voucher, through homeless assistance. And so housing ends up being this musical chairs game, if you will. We have so many chairs or houses, and we have more people in the room than we have chairs. And so if you end up having any sort of barrier like extremely low income or a past eviction or involvement with the courts, that ends up making it even harder for you to find the housing that you need and that you can afford in the place of your choice. So next slide. Part of the reason for that, most of the reason for that goes back to our housing shortage, which Dustin alluded to. Statewide, we have a shortage of over 200,000 homes as measured in 2024. If you look at it across the income spectrum, it's pretty evenly divided between rental and single-family home ownership. But when you start looking at extremely low income and moderately low income segments of Kentucky, it is really, really driven by the shortage in the rental market. And when we look at the number of houses or homes needed for people who are poor and working class, that is where the biggest shortage is coming from. Excuse me. Next slide. Okay. So if we do not seize this opportunity, if our policymakers do not make policy changes, excuse me, we can expect this deficit to grow to nearly 300,000 homes, 287, 120 to be precise. And again, the biggest deficit is coming for 0 to 30% area median income. Apologies. I managed to catch a cold over the weekend and it is still catching up with me. Next slide. Okay. So the shortage actually is what is driving up rent across the board. And when rents go up, we see other policy outcomes, including 1 in 4 Kentuckians paying more than 30% of their income toward housing, and 2 out of 3 extremely low income renters paying more than 50%. So when you are paying that much of your income towards housing, it leaves very little else for just life, right? When rents go up, we see people pushed out of their rental homes into homelessness through evictions, through other doubling up, that sort of thing. And so we've seen a rise in homelessness really over the last few years. Is really attributed to skyrocketing rents, even here in Kentucky. And we see a significant difference between our home ownership rates. Overall in Kentucky, we have a relatively high home ownership rate. When we look at the home ownership rate for Black and Brown Kentuckians, it decreases quite a bit. And so our state housing wage over the last 8 years really has increased quite a bit. In 2017, it was $13.95 an hour to afford a two-bedroom home. In 2025, according to the Out of Reach report, it had crossed $20, and now statewide is $21.47. Next slide. Okay. So over the past year, there have been a lot of federal policy developments in the housing realm. They haven't really contributed to increasing housing supply or lowering the cost of housing, but I think it's important to take stock of where we have been. So in May, the administration, the White House, releases its skinny budget. It included proposals to block grant and cut homeless assistance by $532 million, and limiting assistance to 2 years. It included a proposal to block grant and cut rental assistance across the board. The whole 1 in 4 families at the beginning of this section, it would make it even worse. And then it proposed to eliminate housing supply grants. In the meantime, Congress still had a role to play. And so they were working on appropriations kind of on a separate track from the White House's proposals. But they were not, as you know, from the government shutdown, they didn't quite get to finishing their work, right? In the meantime, the White House comes out again in July, issues another executive order that would direct federal agencies to address homelessness, not through, again, increasing the housing supply or lowering rents, but increase forced institutionalization, data sharing with law enforcement, implementing barriers to receiving housing assistance, and directing all of the relevant agencies to make that happen. So then in August, September, as I said, congressional appropriations work kind of continues on a separate track from the White House's proposal. Next slide. So after the longest government shutdown, the government reopens. We have a continuing resolution that includes HUD programming for only about 2 months, through January 30th of 2026. For USDA housing programming, United States Department of Agriculture, there was funding because there was full funding for like all of USDA through the end of the fiscal year that ends September 30th of next year. So then less than 24 hours after the government reopens, the Department for Housing and Urban Development, or HUD, publishes the FY25 Continuum of Care Notice of Funding Opportunity with the due date of January 14th, 2026. So we will get into in a minute what COC funding is, what those words even mean. In the weeks after, 2 lawsuits were filed. Kentucky was part of one. It was a multi-state lawsuit, and then there was one with plaintiffs from national groups and local groups to raise the harms that would happen to states who weren't covered by this multi-state lawsuit. On December 7th, last week, HUD rescinds this Continuum of Care Notice of Funding Opportunity, says it intends to issue another NOFO later, but it still has not issued renewals for homeless assistance grants that were scheduled to renew in 2026. And as far as the lawsuits go, the next hearing is December 19th, which is this Friday in the U.S. District Court in Rhode Island. Next slide. Okay, so what is a continuum of care, or a COC? Kentucky has 3 COCs. We have the Balance of State, and we have Lexington and Louisville. So the Balance of State is consists of the 118 counties that are not Fayette and Jefferson. So nationally, 170,000 formerly homeless people with permanent disabling conditions who are housed through COC programming, they would be at risk of returning to homelessness were it not for this assistance. In Kentucky, we currently have 2,600 people on continuum of care permanent housing assistance. And currently, nationally, 87% of COC funds go to permanent housing in the form of rent subsidies and housing stability services. In Kentucky, it ranges across the 3 COCs. The average is about 60%. The Challenge NOFO capped the amount of permanent housing that could go next year to 30%, down from the 60-ish percent that is currently allocated in Kentucky. And so what that would mean is an immediate loss of $20 million that is currently providing permanent housing to formerly homeless Kentuckians. Next slide. This proposed continuum of care NOFO encourages transitional housing projects instead of rapid rehousing or permanent supportive housing, which traditionally has been a more expensive intervention and ultimately results in the same issue. After somebody graduates from transitional housing, they're still facing the same unforgiving rental market, and they still don't have a place that will take them, right? Another element would be required service participation, which effectively means additional barriers to obtaining and retaining housing. Funding tier decisions put existing housing assistance for formerly homeless Kentuckians at risk of being defunded in favor of other projects in other states. So this is kind of wonky, so bear with me, but HUD over the last 10-ish years has encouraged competition, and so they have split their COC funding into 2 tiers. Tier 1 was reserved primarily for renewals, with the understanding that if you are funding projects on a year-to-year basis, there has to be some stability, especially if you are trying to do permanent housing. So tier 1 is usually between 85 and 90%. Tier 1 under this proposed NOFO, and maybe the next one, who knows, is reduced to 30%, which means that all of these projects that had expected to renew are suddenly competing all across the country. So this means additional funding on top of the $20 million would be jeopardized. Next slide. Okay, so turning to the state, I just wanted to name a couple of the housing laws that came from the 2025 session, which feels like a lifetime ago, but was earlier this year. One was House Bill 160, creating parity in local zoning requirements for manufactured housing. Senate Bill 25, that would allow multifamily housing developments of 48 units or more to be included in the definition of building for industrial revenue bonds. And Senate Bill 129, which was a Louisville-specific law designed to help housing nonprofits turn blighted and abandoned properties into affordable housing. Next slide. All right, so Dr. Schuster talked about all the interim task forces. We were really pleased to see that housing was an interim task force both in 2024 and 2025, with the recognition that there is still a lot of work to do at the state level to increase housing affordability and supply. So I've linked here the final task force report. It's about 8 or 9 pages with some comprehensive recommendations. A lot of it is around easing regulation, but also there are some funding recommendations, which we will get into. If you are interested in engaging your legislators who were on the Housing Task Force, the membership is listed on the right-hand side. We do anticipate that the co-chairs will be carrying forward some legislation based on the recommendations laid out in the task force reports. Next slide. All right, so from HHCK's perspective, State-based housing solutions need to be grounded in three foundational pillars, if you will. One is increasing housing supply and affordability for extremely low-income Kentuckians. Two is improving access to housing for people who are housing insecure. And three is creating statewide renter protections. So these three bills are bills that we worked on in the 2025 session and that we anticipate will be filed in the 2026 session. The first one modernizes and indexes the fee structure that funds the Affordable Housing Trust Fund. It's filed by Representative Steve Bratcher from Elizabethtown. It was one of the recommendations in the task force. Right now, the fees that fund the Affordable Housing Trust Fund, or AHTF, are only generating about $3 to $4 million annually. And that is not enough to keep up with the amount of supply that we need. House Bill 534 is expungement of dismissed evictions and minors improperly listed in a filing. And it was heard in the Interim Judiciary Committee in October. Senate Bill 59 is known as Yes in God's Backyard, and it was also listed as one of the task force's recommendations. We anticipate this bill will be filed by Representative Pollock in the House initially in the beginning of the session. Next slide. Okay. So here are some next steps. We work closely with the National Low Income Housing Coalition. They have a couple of calls to action and toolkits available. Right now, there is still appropriations work to be done between now and January 30th to ensure that we have sufficient funding for our housing programs. So if you're interested in that work, check that out. At the state level, if you're interested in eviction reform and the advocacy around it, you can join the Welcome Home Kentucky campaign and check that out. It's a broad base of many folks working across the state to ensure people have a fair shot at housing moving forward. You're free to follow us on socials, and also we're having a housing advocacy day at the Annex. And potentially on the outdoor grounds, depending on the weather, as Dr. Schuster mentioned, and feel free to RSVP. It's January 13th, 2026. And lastly, if you're interested in working locally, the American Planning Association has a housing supply accelerator, and you should check it out. And with that, I will turn it over to the next presenter, who I believe is Jordan, doing food.
That sounds
Okay,
like my cue. All good. Yeah, my name is Jordan Ojow. I am the advocacy manager for Feeding Kentucky, and I'll be talking to you about food system and assistance, what the landscape when it comes to food insecurity looks like in Kentucky right now. Next slide, please. So when people talk about food assistance programs right now, especially given the context of everything that's happened this year, the most likely first thought people have is the Supplemental Nutrition Assistance Program, otherwise known as SNAP, formerly known as food stamps. So thanks to the chart here, we can see a pretty clear illustration of what SNAP participation has looked like over the last few years, including 2025 data. And as we have a conversation around SNAP, I want you to keep some of these figures in your mind, especially as it comes to myth busting some talking points you may hear from the news, from certain legislators, or from in-laws at the holiday kitchen table. So the most important one that I'll highlight for y'all is as of December of this year, we have 563,000 Kentuckians on the program. Bearing in mind that food insecurity for the state is north of 700,000 per latest estimates. So there's a clear gap of people participating who could be. Only about 65% of eligible Kentuckians are participating in the program. And this great program brings in around $1.3 billion each year. And the average SNAP benefit for folks participating is around $174. Obviously, that scales depending on whether you have dependents in the home or not. And it is worth noting that we'll get into some of the updates that have come down from things like the Big Beautiful Bill. But the most important change is that legal residing immigrants are no longer eligible to participate in the program. Next slide, please. So, like I said, Kentucky is the seventh hungriest state with over 700,000 people here facing hunger. 1 in 4 Kentucky children live in a home without enough food, and we have the second highest rate of hunger for older adults, those within the 50 to 59 year age range. We are the second highest rate nationally, which is not a great way to be leading the pack right now. And the chart to the left gives you a map of Kentucky as it relates to food insecurity pockets across the state. Obviously, Appalachia is hurting the most in this regard, but there is hunger in every Kentucky county. Hunger knows no zip code in the Commonwealth. Next slide, please. There are clear consequences to food insecurity. It puts the health of children and older adults at risk with consequences across their lifespan. It will also decrease preventative health behaviors, and that results in higher healthcare costs down the line. It's worth noting that food is one of the most upstream solutions for everything from educational achievement, healthcare outcomes, to crime. And we rank poorly currently when it comes to health outcomes, especially as it relates to nutrition-related diseases like obesity, diabetes, asthma, and mental health. And it's also proven that food insecure adults are likelier to have chronic illness by leaps and bounds compared to their food secure cohort. Next slide. The government shutdown, personally, I can attest, working in Feeding Kentucky, had a clear and sustained impact on the feeding ecosystem, but especially on SNAP. As of November 1st, $106 million in SNAP benefits did not go out in Kentucky. For a little bit of scale, some of our food banks' budgets are dwarfed annually by just a month's worth of SNAP benefits. It is absurd to consider that food banks could be a substitute for SNAP when you take into account that SNAP provides 9 meals for every one that a food bank does, for a little behind the scenes perspective on the feeding ecosystem during the shutdown. They had about 5 to 6 billion in SNAP contingency funds that it declared that it would not use, but they legally became obligated to, and thanks to a national lawsuit, some of those funds were later released. November 15th, benefits began to roll out after a 2-week delay, and despite prior legal confusion, benefits are fully valid and usable, and stores face no penalties for accepting them. As I'm sure you can imagine, the shutdown caused a great deal of mayhem, and there was a lot of misinformation circulating about. And the continuing resolution that passed ensures that SNAP is fully funded through September 2026, which creates some stability, but obviously our eyes are always turned towards the horizon on the next time we might have to battle something like this. Next slide, please. So there are some changes to the timeline from the Big Beautiful Bill that happened earlier this summer. It's been a crazy few months for SNAP. Immediately, it ended SNAP education, and it also ended legally residing eligibility for immigrants. So SNAP education is a program that taught participants how to best use their benefits for a nutritious diet. I feel like I'm sneeze. And it doesn't want to come. So as of October of 2025, it also ended SUA and LIHEAP and the internet deduction when it comes to qualifying for SNAP benefits and how much benefits you get. And over the next few months, as guidance is implemented, SNAP work reporting requirements will expand and waivers will end as it relates to SNAP. So obviously that's going to affect people's eligibility, and it's very possible that we could see some folks being removed, even though they do qualify rightfully. And then in October 2026, the SNAP admin cost increased from 50 to 75%, about $60 million that Frankfurt will need to make sure that they have allotted in this upcoming budget session. Otherwise, again, SNAP will cease to function if it does not receive these costs, at least function in the current form. This is untreaded territory. We're not quite sure what it would look like. But that being said, we are very confident as of right now that the admin costs will wind up making it into the final budget. The tone that we've received from the Appropriations Committee over the last few weeks and amongst other key legislators is that that has already been packaged into their considerations, and they are aware of how crucial it is that the admin cost is included. As of October 2027, SNAP cost share requirement will begin. That could be anywhere from $0 to $253 million a year. and that's all based on our error rate. As of right now, we're kind of crushing it in the error rate department. We've got we're in the top 10 for lowest error rate in the nation, and our current error rate as of today does not qualify us for a cost shift, which means we won't have to pay for anything as a state when it comes to providing SNAP for our participants. But if for whatever reason that error rate increases, it is important that we have those funds set aside, which is why, given the kind of awkward clunkiness of only having a budget session every 2 years, they had to allocate dollars. They have to allocate dollars this upcoming session, just on the off chance in October 2027 we need to have that money ready for whatever reason if our error rate increases. So, kind of a tricky situation. It's almost like this was not implemented with the most thoroughness of thoughtfulness. So, that is the latest timeline as relates to HR1 and its implementation around SNAP. Next slide, please. So, like I said, the cost gets pushed onto the states and starting next year, and it's very possible that we will need up to 250 million per year to keep Kentuckians fed, and that's going to be determined by our error rate from this year as well as next year. Error rates, to be very clear, are volatile, complex, and are not a measure of fraud or poor administration. It's next to impossible to achieve a 0% error rate, and it's a Herculean task to maintain a low one. As it relates to an error rate, it's important that folks realize that it could be an over allotment of benefits or even an under allotment. And SNAP is a naturally self-correcting program. If somebody receives too much SNAP benefits 1 month, they will receive less in the next to compensate for that. So it's quite ridiculous to assume that an error rate has anything to do with how a state is administering the program or that people are defrauding the program. 2024 rates were high because of increasing hunger, staff shortages, bad technology, and new regulations. And it's very concerning that some of our colleagues across the other states are relaying to us right now that some of the states might not be able to participate at all. They may not be able to pay for their cost shift and thus would eliminate SNAP in the state. And again, this is uncharted territory. We don't know what that would look like for us. So this pits legislators against paying for food assistance against other vital needs in the state budget: education, childcare, infrastructure, etc. So it was quite the snarl that was handed down from Congress to Frankfurt. Next slide, please. So again, this is a chart that gives a little breakdown of what we could expect in terms of what our error rate is going forward and what we could expect to pay as a state should we see that error rate increase. Next slide, please. So new work reporting requirements, people between the ages of 55 and 64, people with a child over 13, veterans, people experiencing homelessness and former foster youth, and people living in areas of high unemployment where work reporting requirements were previously waived will all lose their waiver as it relates to work reporting. So now there's another hurdle for folks to receive SNAP, and this will jeopardize the program for around 114,000 Kentuckians, and that is unacceptable for even one Kentuckian to lose their benefits over something as onerous and unnecessary as this, given how well employed the vast majority of folks on the program are, either employed, retired, or disabled. That makes a regulation like this purely burdensome and altogether unnecessary. And it is by design going to kick people off the program, unless, of course, they manage to find work opportunities or volunteer opportunities that fit within this scope. So that is something else to be aware of. And if you need help with exemptions, please contact a SNAP connector or call the number on the screen. Next slide, please. So SNAP restrictions as it relates to purchase restrictions, this year, it's been quite a 12 months, I got to tell you. Earlier this year in session, we experienced HB 279, which sought to restrict what people could pay their SNAP dollars towards, restricting junk foods, or what it designated as junk foods, I should say. And a lot of other states have started to adopt similar programs, and we fully expect to see the fallout of that here in the near future. And there's no evidence that restricting SNAP purchases will change shopping or lifestyle behavior. Also, SNAP participants shop near identical to non-SNAP participants, and SNAP ultimately, at the end of the day, improves health outcomes. So this is a very bad faith regulation that, again, will not achieve anything, especially when there are alternatives to incentivize behavior and to increase healthy purchases with SNAP. such as the Kentucky Double Dollars program that operates at some participating retailers and our farmers markets, allowing people to get more out of their SNAP dollars, especially if it goes towards things like fruits and veggies. So we are hopeful that Frankfurt has learned its lesson as it relates to SNAP purchase restrictions and will instead choose to support something proactive like an incentive program instead. Next slide, please. So ultimately, we are hoping to achieve in the near future a School Meals for All program expanding CEP, the community eligibility provision. Roughly 82% of Kentucky students qualify for free and reduced meals. And given the sheer scope and scale of childhood hunger, it's crucial that we expand CEP while we can. But unfortunately, CEP qualifications is based off the number of students on programs like SNAP and Medicaid, which means if SNAP and Medicaid enrollment plummets, so will meal eligibility. And that's something that we are gravely concerned about and we are monitoring diligently. So, school meals are crucial for children to thrive as well as just to learn. So, we are hopeful that we don't see a reduction in these programs' eligibility while also increasing and elevating the expansion of meal qualifications. Next slide, please. So, summer EBT, soon to be Sunbucks, provides grocery money during the summer to address seasonal food insecurity. When kids are out of school, they're not eating in the cafeteria. In 2025, it provided $120 to almost 400,000 kids. And students between the ages 6 and 18 that participated in CEP had to apply, and students aged 6 to 18 who received SNAP were automatically enrolled, which does make the administration aspect of this that much more streamlined. It's going to might look a little different next summer, but schools are already preparing, and I can personally assure you, as someone who works alongside the folks that do this work, it is a well-oiled machine and is a crucial support and lifeline to Kentucky families that need food in the summer. Next slide, please. There are also senior feeding programs with 1 in 5 seniors in Kentucky going hungry. It's crucial that we address this. And our state budget must continue to fund senior hunger through Dale. And we are optimistic that the enthusiasm expressed earlier this year about funding those programs carries itself forward into session as they really prioritize food insecurity programs. So keep an eye on senior feeding programs as session unfolds as well. Next slide, please. So if you want more food resources as it relates to advocacy, please feel free to join the Kentucky Food Action Network. I serve as a staff member on it alongside a member of KY Policy as well as Community Farm Alliance. We have monthly work group calls where we talk about food assistance, child feeding, agriculture. It's a great space to get informed, but also get involved. So I would love to see all of you there. Please feel free to reach out to me after this call if you want to participate, and I can get you signed up for those calls. It's a great space for discussion and learning. So there are also some more links on the screen as it relates to SNAP connectors, the WIC website, as well as senior meals and food banks. So with that, I believe that's my last slide, so I'll pass it off to the next presenter.
Thanks, Jordan. Hi, everyone. I'm Priscilla Easterling with Kentucky Voices for Health. We're going to cover some healthcare updates. Next slide, please. All right, so just to help set the stage, when we're talking about Kentuckians' access to healthcare coverage, the really good news is that of the 4.4 million Kentuckians, the vast majority, almost 2 million, almost 4.2 million, are currently insured or have access to health coverage. Most of that is almost evenly split between public insurance options and private insurance options. So when we talk about when we talk about public insurance, that's going to be Medicaid, Medicare, and then other benefits like TRICARE or veterans benefits. And then private insurance is coverage through your employer or Connect Marketplace is also in that bucket. And so are individual off-market plans as well. Unfortunately, they're around 250,000, a little closer to 260,000. And truly that number might be a little bit higher that are currently uninsured or do not have any sort of insurance coverage or access to coverage. Next slide. And so looking at those 200 and almost 60,000 Kentuckians who are uninsured, the vast majority of them are employed. More than almost 200,000 with a household member that has a full-time job, but those jobs do not offer and do not offer health coverage or health insurance, either for the employee or for other members of the household. The majority are likely already eligible for some form of federally subsidized coverage. About 110,000 who are eligible for Medicaid and don't know it or who are not enrolled, and around 82,000 who are eligible for a qualified health plan and AC eligible plan, but are not enrolled. And then the other really big number that I think is just an important reminder for folks that 150,000 of those of the uninsured Kentuckians do not have internet, and 70,000 do not have reliable access to a cell phone. So when we're talking about doing outreach and trying to make sure that folks have connections to be able to get enrolled in health insurance, we cannot only look at the internet or cell phones as the way to do that, because that is just not accessible for everyone. So a lot of those connections are going to have to be made, in office with folks who have the resources, who are asking the question, do you need help with health insurance? Do you have access to health coverage? And are doing those warm handoffs and making referrals to other folks who can help folks navigate and figure out which insurance options might work for them. So just a friendly reminder about our uninsured Kentuckians. Next slide, please. And so as we're also talking about the One Big Beautiful Bill, HR 1, a lot of those, we're still looking at this implementation timeline. The biggest changes are going into effect right now on the marketplace side of things. So at the end of this month, the special enrollment periods are the low income special enrollment period that has been in effect since 2021. That's going away. And tax credit eligibility, if you have not reconciled your tax credits in the past, that will affect your future eligibility for premium tax credits beginning January 1. And then also beginning next month, it eliminates the subsidies for lawfully present immigrants with incomes under 100% of the federal poverty line. All of the Medicaid changes, the eligibility changes, those will be going into effect in October 2026 and then December 2026. So we'll have some more updates this time next year. Next slide, please. And one thing that we have talked quite a bit about, if you've been to any of our webinars throughout this year, there have been enhanced premium tax credits that have been in place that were originally passed with the American Rescue Plan Act back in 2021. Those subsidies were again extended in August 2022, and they were set to expire at the end of December 2025. There were a couple of different bills that were introduced. Excuse me. There were a couple of different bills that were introduced and voted on by the Senate last week. And unfortunately, all of those votes failed. So right now, it currently looks like those enhanced premium tax credits will expire at the end of this month, but there is still time for Congress to act. It will take them figuring something out, but right now it looks like the decision is to just let them expire, which is really unfortunate because we're seeing folks see their average premiums increase significantly. The average premium jumps from $139 a month to $325 a month, which is just a huge jump, almost $200 more just on the health premium, and that says nothing about what it actually costs to go to the doctor. So we're seeing that sort of play out in open enrollment, which I'll talk about here in a minute, but just a reminder that those are expiring at the end of this year. Next slide, please. So we're already seeing throughout that uncertainty of whether or not those premium tax credits would be extended already is causing issues for this year's open enrollment for for plan year 2026. We saw CareSource leave the marketplace entirely, and Molina pulled out of around 35 additional counties. And so we're seeing that most counties in Kentucky currently only have two options, WellCare or Anthem. And a couple of other counties only have one option in Anthem. So it's already reducing options that are available on the marketplace. Next slide, please. So it is still open enrollment, and today actually is the deadline for coverage for January 1. So if you know anyone who needs coverage beginning January 1, today is the day to make that, to go ahead and choose a plan and enroll. Now, Connect was down from sometime early yesterday morning, and it was just fixed and went back online right before noon today. So the system is up and functioning as usual right now. But if you know folks who got caught up in that and were unable to shop or enroll in a plan, and then now they're spending the day at work or just unable to get enrolled, if they need help, I absolutely have them reach out to a connector. They can call the call center, or they can reach out to a licensed insurance agent, and they'll be able to help them either enroll in a plan today before the deadline, or if they attest to having been impacted by the technical difficulty from the system being out over the last 24 hours, the state will still manually approve their plans to begin January 1. So if you know anyone or hear any stories like that, make sure that they reach out to a connector or a licensed insurance agent. And again, deadline is today for January 1 coverage. If you need coverage beginning February, you'll have the rest of from December 16th through January 15th to get enrolled. So don't forget that. And then Medicaid and K-CHIP are always open for enrollment, and you can always apply throughout the year. And then the Medicare open enrollment dates just ended last week as well. So really busy time. If you know folks who need help, please reach out to a connector or licensed insurance agent or a SHIP coordinator for Medicare to get them help. Next slide, please. And as we were talking about those premiums increasing, we're hearing so many stories from individuals and families across the state. We're trying to collect those stories so that we can show the real impact of those rising costs and really help shore up how important it is to have affordable coverage. We have this survey that our partners at KY Policy have put together. Please, it takes 2 minutes to share your story, and every single story matters. So if you know anyone or you yourself are experiencing a big premium increase between your 2025 coverage and 2026 coverage, please follow that link to the connector, to the Connect Story Collector, and share your story, please. And share that out as you can to other folks who might have a good story to share. Next slide, please. And as a reminder, we've also talked about this quite a bit this year. Child renewals restarted back in July 2025. It's really important, and adult Medicaid renewals are sort of switching gears, but adult Medicaid renewals are back to normal and continuing as usual. But for the children population, around 660,000 children who were enrolled in Medicaid, they had to restart their renewals back in July. So the most important thing to know, make sure contact information is up to date and Connect. You can do that by logging into the Connect self-service portal to check case information. If you need help with that, you can call the Connect hotline, reach out to a connector for some assistance, or you can even ask your doctor at the doctor's office to check KY HealthNet portal to see when your renewal date is, so that you can reach out and make sure that your information is up to date before your renewal is due. Make sure to check your mail and respond to any notices requesting updated information. There's a great explainer here that's linked in English and Spanish, and then DMS has also put together a good renewal packet with a little bit more information that's particularly helpful for providers. Next slide, please. All right, so looking at the most recent data that we have is October. The November data will be released later this week. But for October, the good news is that the vast majority of children and individuals were approved. That 0 to 6 and 7 to 18 bucket is just under 44th or just over 44,000 kids who were approved, and then around 13,000 who were terminated for October. And next slide, the vast majority of them were terminated because of failure to return a form or failure to verify their information. Next slide, Brady, please. Oh, thank you. So you'll see where that's kind of played out. Medicaid enrollment overall has dipped a little bit if you look around the September 15th and October numbers, but overall it's still relatively level, because as folks are getting disenrolled or just terminated from Medicaid, more folks are still applying. And so case activity happens all throughout the year, but it is hovering right over 1.4 million. So just a note. Next slide. And then, yes, so since July, around a little over 113,000 children have gone through their Medicaid renewal so far, and 81% of them were approved, 92,000. But about 20% have been terminated, a little over 21,000, and again, the vast majority of those have been because of procedural barriers, like not returning a form or not verifying their information. And so it's really, to me, very concerning that we're not seeing that folks are not eligible for Medicaid, but they're just not being able to turn in their documents or complete that enrollment process. And I'm not sure if it's, what might be causing that. So if you are hearing any stories, if you know of anyone who, any clients who are enrolled in Medicaid, please encourage them to engage in that process, to return an email, connect them to a connector, or help share some stories about technical barriers that are going on, so that we can hopefully address them and work with the state to identify and fix them. So if you know anyone, please let them know that Medicaid renewals are happening and they do need to act so that their kids do not lose coverage. Next slide. And a final reminder is that the most important reminder of all of that is that income limits for children are so much higher than they are for adults. So one thing that I am concerned about is that there are adults who look at the income limit and like, oh, we're over that. Our family is not going to be eligible for Medicaid, so we're just not going to send in our documents. But let's remember that the income limit for children is so much higher. So for adults, for a household of 4, 2 adults, 2 children, for the adults to be eligible for Medicaid, their income has to be 44,000, but for 44,000 or lower. But for children, it's 70,000. So don't assume that just because you might not be eligible for Medicaid, or just because an adult client might not be eligible for Medicaid, that their children might not be. When in doubt, just fill it out and let the state make that final determination for you. Next slide. So let's work on keeping Kentucky covered. Next slide. So as we're still preparing for OPA implementation, be prepared to share out information and graphics. There are a lot of big eligibility changes that are happening. We've put together a lot of one-pagers on our Kentucky Voices for Health and our Thrive partners. We've put a lot of one-pagers together, really walking through some of these big changes. Make sure to share them with your clients, walk through them with your clients. Let folks in your community know what's coming, so that we can start getting the word out now and preparing people for how to navigate all of these new changes. There will be opportunities to participate in system design meetings, system testing. Make sure to check those out. And then, this is always a good reminder to attend committee meetings as possible, schedule individual one-on-one meetings with your local legislators, meet up with them, let them know what the impact of these policy changes are in your community, or could be in your community. Next slide. And we've put together a great implementation checklist that is linked there, and it offers practical steps, some county level data, a link of all of those educational materials. And really, again, it's to help make sure that folks are able to get informed, or they're supported and equipped to still access the care and resources that they need during this transition. So make sure to share that out as well. Next slide. And then it's still open enrollment, but this is evergreen. Every conversation that you're having with clients or folks in your community, just make sure to check in about their health coverage. Are they having any problems accessing, getting enrolled? Are they having any problems? Did they get any mail that they don't understand? Did they get any notices that they're not sure how to act or what to do? Are they not sure where to go? It's so important to make those warm handoffs to local connectors and SHIP coordinators, because those are the folks who can really walk families through all of those steps to make sure that they are getting appropriate healthcare coverage and the best coverage for them and their families. So inside about open enrollment and all year round, just make sure you're checking with your clients. Next slide. And in case you don't know what a connector is, they're incredible. I'm a little biased as a connector, of course, but they're a free resource and they're available in all 120 counties of Kentucky, and they can really help both with health coverage, assist with enrollment, the process, the application, all of that. They can also help create referrals within Connect resources. And they agree to act in the best interest of residents and provide fair and impartial information. So if you don't know a connector, they can also help with health and food, as Jordan was talking about SNAP connectors as well. And they can help folks walk through that entire process, recertify their benefits, and report any changes. If you don't know a connector, definitely find one in your community and make them your best friend. They're an incredible resource for a referral for clients. Okay, next slide. Another great one pager. As we've talked about, there will be some eligibility changes for immigrants in our community. And so it's really important to know that those, to be able to understand what those eligibility changes are. So we've put together another one pager about what those changes are related to the One Big Beautiful Bill Act. And then if folks do not have health insurance, this is not just related to immigrants, but if folks don't have health insurance, here's some other resources about what to do if you're uninsured, as we do expect that that number is going to climb related to One Big Beautiful Bill Act changes. So next slide. And then make sure to watch out for junk plans, especially during open enrollment. We hear all the time, stories of people Googling health insurance and clicking a link and something being offered like, here's $30 a month. And, you can get it right now. It's instant. And otherwise there are no good details. There's no definitions. They ask a lot about your medical history, all of those things. Make sure that you know what you're buying. Ask those questions. If you're looking for an ACA plan that's going to cover all of your essential health benefits, typically those plans never ask about, no plan on the marketplace ever asks about medical history. Off the marketplace, they might. Make sure that you understand what those plan exclusions are, what that red tape is, what is actually being offered, because there are lots of plans that sound good, but then when you actually use them, they don't actually cover all of the things that you need it to cover. And sometimes they can choose to disenroll you rather than cover a new medical determination or something that comes up during an exam. So be very careful, ask for a license number, never share personal or banking information over the phone. And if you need any help, we put together this great one pager that really walks through what to look for, what the risk is, and who to reach out for, who are trusted people you can reach out to. So, and if you need help, you can always contact a connector in your area. Next slide. And then our last Keep Kentucky Covered Coalition is meeting this Wednesday at 2 p.m. virtually. This is where we've talked a lot about these One Big Beautiful Bill Act changes. But if you have any questions about Medicaid, legislative updates, or other key health updates, please join us. That's this Wednesday, our last one of the year. The Wednesday, December 17th at 2 p.m. virtually. And if you'd like to join, reach out to Alex, please. Next slide. And then here's a great list of other resources that we've put together on all of our different talking points. We have our Kentucky Medicaid Defense Toolkit for your advocacy as we're going into session, but we also have great other helpful one-pagers about non-emergency medical transportation, special enrollment periods, health language access, childcare assistance, all of the works. And those are all linked there as well. So with that, I will turn it over to Dr. Schuster.
Thank you, Priscilla. That's a great rundown of so much information. And thanks to Holly for putting so many links in the chat for you. So it's me again. I'm wearing a little bit different hat, putting on my psychology hat, and also as a board member of Mental Health America of Kentucky. You may have seen some information from MHA. They have what looks like the Liberty Bell, although it doesn't have the crack in it, and that's their logo. And I always remind people that the original one, which is at their office in DC, was made by melting down the shackles that were used in the insane asylums to keep people shackled to a bed or to a chair or to wherever they wanted them to stay. And it's a reminder to us all that we have not had a great history in this country or in most of the world in treating people with severe mental illness, people with intellectual and developmental disabilities, people that were almost incarcerated in what were called hospitals or asylums, but they were not giving much care. So just want to remind you that we need to do much better. Next slide, please, Brittany. So you hear about the social determinants of health, SDOHs. Same is true of social determinants of mental health. And you've heard about many of these topics from our earlier speakers. Employment, food security, housing, we know is huge. At our recent annual meeting, one of the audience participants stood up and said, housing is health, and it really is. Social exclusion, poverty. If I had a magic wand and could solve all the problems of Kentucky, I would start with raising the income level of every single Kentuckian, because that's a root cause. And poor access to health care, also education inequality. Next, please. So unfortunately, one of the statistics that Kentucky does not do well in is that we are losing a lot of people to suicide. And also we have a lot of Kentuckians, mostly females, pre-adolescent, adolescent, young adults who do self-harm. So here are some of the statistics. I would point out that the means by which most people in Kentucky commit suicide is by a firearm. That's twice as high as any other means of suicide. So just a gentle suggestion, if you're worried about somebody in your sphere of contacts that might be so depressed that they're suicidal, you really need to check to make sure that they don't have access to a firearm. When that impulse hits, if there's a means available and guns are the, I guess, the quickest and easiest, they will take advantage of those. Males are much more likely to die by suicide than females, but as I had mentioned earlier, females are much more likely to have a ER visit or inpatient hospitalization for self-harm. We're also seeing increased suicides among our farmers, and we have to remember that Kentucky is very much a rural and agrarian economy. They have so many things that they cannot control, the weather being one of them. Prices, there's a lot of isolation, lots of threats on the horizon with tariffs and so forth. There's a great resource, Raising Hope, Kentucky, and we've put the link in there. And then the other population of people that we really worry about, particularly young people, are those that are in the LGBTQ category. And it's not because of their gender identification that they're at risk of suicide, but because of the stigmatization and the abuse sometimes that they suffer in society. So just be watchful for those that you love and care for. Next, please. So you all have heard about ACEs, not the card playing time, but the adverse childhood experiences. And I love this particular slide because you all probably know those things that get you a score on the ACEs survey: maternal depression, neglect and abuse, divorce, incarceration. And Kentucky still ranks very high in the number of children who have one or even two parents who have been incarcerated. But if you look below the surface there, where we talk about the community environments, again, those are things that we've talked about on this webinar. They are the things that we don't want our communities to be facing so that they can thrive and so that all of their people can thrive. Next, please. So some good news, waivers are special permissions that we get from the Center for Medicaid and Medicare Services to offer services that are not part of traditional Medicaid. So the one we've worked on for years and years and years would provide services for people with severe mental illness or SMI. and it's called the RISE or the 1915I. It's actually a state plan amendment. Lots of services listed there. We were hoping to get it launched in 2025, but it's going to be probably mid 2026 because we still need more providers to sign up. If you are interested, or if you have someone who might be interested, there's an email there that you can email and get more information. There's a website link. Also, you could leave the name of someone that should be contacted when the waiver does go live. The other one we've been waiting on, and we hope will go live in April, is the reentry waiver. Typically, you lose Medicaid coverage when you're incarcerated, but this gives us special permission to begin offering Medicaid reimbursed services, particularly medication, and contact with the MCOs with someone who is in one of our state prisons, or someone who is in a Department of Juvenile Justice detention 60 days prior to their release. So we're trying to have people not fall off the cliff when they get out of prison or detention. We're very excited about this. And again, we hope that the go live date will actually be this April. Next, Brittany. So other waiver updates. There was a waiver approved last year and is in place to give more inpatient days or rehab days to people with severe mental illness or substance use disorder. Also provides medical respite follow-up care after discharge from the hospital. There's a new child waiver. It's going to be aimed at the high-risk, high-intensity needs kiddos who are in DJJ facilities ready to be discharged into treatment, or for foster youth who are without stable housing. And we've heard about so many foster youth that are spending the night in DCBS offices and don't have any place to go, partially because of either disabilities that they have or problematic behaviors. So these waivers are going to offer intensive treatment for them. And again, that's getting underway with enrollment of providers. And unfortunately, and some of you may remember back in 2023, going into the 24 session, we started a huge advocacy campaign to get the legislature to fund more slots or placements in those 1915C home and community-based waivers. So that's the HCB, the Michelle P, and the SCL waivers. They funded 1,925 slots, which was more than we've ever had before. Those are all filled, but unfortunately, we now have 16,000 individuals on the waiting list for those waivers. So we're going to have to advocate very strongly again for more funding from the state government. Next, please. Just a reminder that the 988 line is out there. It celebrated its 3rd birthday in mid-July. It really has been such a lifesaver. It is available for people in crisis, for people that are caring for or worried about people in crisis. You can call and get information. And Kentucky leads the nation in answering these in-state. So your call doesn't go to somebody in New York or Miami or California. They are answered by the community mental health centers. And so you're talking to somebody who sounds like you, knows the local resources and so forth. Sadly, the direct line for LGBTQ individuals was canceled by the Trump administration in July. Those LGBTQ individuals or people that have questions about those services are still being taken by calling 988, or you could call the Trevor Project, and I have the number there, and your call will be answered by someone in that community. And the Trevor Project is a national organization whose sole purpose is to prevent suicides among LGBTQ youth. Next, please. So just want to remind you that behavioral health, Medicaid, and after that, the Connect policies, all those ACA policies, we call them, are the biggest payers of behavioral health services in Kentucky. So we in the behavioral health community are particularly concerned about what HR 1 is going to do in terms of reducing the numbers of people on Medicaid and also the numbers of people that are getting help in purchasing a qualified health plan. I also want to point out, Priscilla did such a good job to warn you all about jug plans. Those jug plans are not going to cover anything in the mental health or behavioral health if you have that. They're not going to cover much of anything, but they certainly will not cover that. And we're hoping with the Rural Health Transformation Program to get more rural facilities out there to help with behavioral health. Next, please. So this is a map of your community mental health centers, 14 centers. Every county is in one of these catchment areas, so you can look and see where your county is located in the state, and you probably know the name of your comprehensive community mental health center. Again, they are answering those 988 calls, and they are providing not only mental health and substance use disorder services, but also services for people with developmental and intellectual disabilities. Next, please. So this is an incredible resource for Kentucky, and it's sponsored by the Cabinet, by the UK College of Public Health, the Office of Drug Control Policy, Operation Unite, the Kentucky Department for Behavioral Health. This is updated almost daily. And if you have want to find treatment for somebody, you can look for mental health, substance use disorder, recovery housing, naloxone, or just learning materials and information. You can sort it by the area of the state that you want to look at, what you're looking for, whether it's inpatient or outpatient, whether they accept Medicaid, Medicare, private insurance, sliding fee scale, and so forth. So it's up to date to find services for people with mental illness or substance use disorder. It's an excellent, excellent resource. Next, please. So just to remind you that this is a really difficult time. It was difficult all before July, before the Congress took action. And then since then, there's been a lot of anxiety, and some of our previous speakers have talked about some of those impacts. It's also tough with the holidays coming. You know, everybody assumes or presumes that everybody is cheery and happy and jolly with holidays. And for a lot of people, the holidays bring an exacerbation of depression, loneliness, solitude, the loss of loved ones, and so forth. There also is just a lot of anxiety because of the challenges around food security, healthcare access. Kids coming home from college, quite frankly, can be a stress. So keep an eye on yourself and be aware of changes in your own behavior. If they have lasted 2 months or more, check in with your primary care provider. There also is excellent screening that's confidential, and it's offered online by Mental Health America, and the link is there. You can actually pick a survey that kind of fits, you know, there's depression, anxiety, and all kinds of, and some for kids as well that parents can fill out. So my basic message is, when in doubt, reach out for help. It's always better to catch a problem early on. And then a final slide, I think, Brittany. Yeah, just some suggestions from Mental Health America about some things you can do. It actually has been shown in research that if you're in the doldrums, if you will, that it actually helps you, your brain activity and your mood, to reach out and help somebody else. So look for people in your neighborhood that might just need a cheery greeting, or someone that might need to be checked on, and get engaged with other people. That is also very helpful. And then a final slide, I think, is just a reminder, yes, that mental health help is available. Don't hesitate to reach out and ask. And I think that I'm ready to turn it over to Emily.
All right. Thanks,
Yes.
Sheila. And thanks
All
to all
right.
of our speakers. We have a few minutes left if there are any questions that people have kind of burning. I've been trying to keep an eye on the chat. Anything people want to bring up right now while we have a few minutes? All right.
Emily?
Let's go to yes.
Yeah, we had a question in a group on Friday. I had a question asked, and that was about the work requirements for SNAP. I don't know if Jordan is still on. The question was, are there exemptions for people if they have a disability? We know that there are going to be exemptions for the work requirements for Medicaid, but I didn't know are there exemptions, Jordan, for people with the work requirements?
I heard the answer to this question the other day because it was just asked, but I cannot recall off the top of my head. Dustin, do you remember?
Well, yeah, so the work requirement for SNAP is primarily aimed at adults up to age 64 who have a child in the household under the age, or sorry, over the age of 13, who don't have a documented disability. In other words, if you have a disability and it has been documented with the state, either through a report from your doctor or through, in some cases, self-attestation, then that requirement will not or should not apply to you. Now, if you have a disability and you've received a notice from the state that you're going to have to start reporting work hours in order to maintain your SNAP benefits, something has gone wrong. You need to make sure that you reach out to a SNAP connector or through DCBS. Valerie, yes, that includes under Social Security. So if you have SSDI or SSI, then the SNAP work reporting requirement should not apply to you. It's only for non-disabled adults under certain circumstances.
All right, thank you very much. And Valerie was the person that had asked me that question in an earlier meeting, and I didn't know the answer to it.